So so many studies like Leopold and all and published in critical care medicines and anesthesia journals, all these studies will show ICU hypothermia is associated with worst outcomes, both in terms of mortality and even morbidity also. So what are the outcomes which we generally see? It includes like simple morbidity, like the coagulopathy will get worsened, especially in post-op patients. If the coagulopathy worsens, they might bleed more. Infections, more the usage of antibiotics, more the prolonged ICU stays. That leads to prolonged financial burden on the patients. So it's going to add a lot of burden on the patients, both financially as well as morbidity-wise when it comes to health-wise also. So, as a physicians, as a critical care specialist, recognizing these risk factors and understanding what are the presentations of a hypothermia commonly in my patients is crucial. Most of the doctors neglect that this acute confusion state, as I'm telling you, these patients might be lethargic or mild confusion. They might attribute it to anesthesia. They might attribute this to electrolyte disturbances like sodium and all. But remember, guys, even hypothermia is also one of the most important point you're never supposed to forget here. So once the hypothermia gets triggered, it leads to coagulopathy. That coagulopathy means unable of the inability of the blood to get clotted is called as coagulopathy, and then that leads to acidosis. The more the levels of acidosis in the body, this triggers a vicious circle like hypothermia, coagulopathy, and acidosis. We call it a circle of death in ICU. So you have to break this circle here. So instead of treating it after the complications happen, you have to prevent it before the complications happens. So that's the quality of a good doctor, right? So you need to identify the hypothermia as early as possible in the ICU.